So we're going to talk about the middle ear today. The middle ear also seems like it should be a pretty simple thing, but actually diagnosis and treatment can be quite complicated. So the middle ear is between the external ear, which is the funnel that brings sound waves to the eardrum, and the inner ear, which is really the electronics of the ear. So its job is to transmit acoustic energy from the eardrum through the little ear bones to the electronic portion of the ear. It is allowed to equilibrate through the eustachian tube. So the eustachian tube is a tube you use to pop your ears open when you're going up and down in an airplane. So some people do that. That's called the Valsalva maneuver. Some people yawn. Some people don't have problems equilibrating and their ear equilibrates normally. Obviously, we're not really made evolutionarily to be changing elevation that much, so sometimes we have to manually do it. So the first thing that can happen, and that's something we see most commonly, is I can't pop my ears. And that generally means eustachian tube dysfunction. The eustachian tube is the pop-off valve, and when it's not working, there can be a differential in pressure between the middle ear and the external environment. And so that can be relieved by popping the ear or yawning. But people often say, I get a little bit of decrease in hearing from that too, and that's because the eardrum is not vibrating as it would normally. It's not a severe hearing loss generally, but enough for people to notice. And they say, boy, when I get my ear popped open, I can hear better for a little bit, and then it's back to its normal self. So treatment for eustachian tube dysfunction has been more difficult than you would expect. So nasal steroid spray can be used in the head hanging position. So right hand, left nostril, left hand, right nostril, and then laying over the bed to allow the nasal steroid to go to the opening of the eustachian tube, which is also in the back of the nose here. So a lot of people get better with that. Some people don't. So then the treatment of the eustachian tube dysfunction, which we generally are going to confirm by getting a hearing test and some test of eardrum pressure called a tympanogram, is going to depend on the symptoms of the patient. So the greater the symptoms, the greater the response to more surgical therapy. For example, if someone says, yeah, I'm a little annoyed by it, it doesn't really bother me, I can fix it, just doesn't bother me that much, probably not going to enjoy any surgical intervention. Somebody who works at Heavenly Valley, goes up in the tram 20 or 30 times a day and has excruciating pain every time, they're going to benefit from therapy. So what are the traditional therapies for eustachian tube dysfunction? Placing a tube in the ear just like we do for kids for recurrent ear infections. So a tube is placed here, it looks like a spool of thread, and it equilibrates pressure through a little hole in the spool. So you can go up and down in elevation. The pressure is relieved through the tube, and there is no accumulation of differential in pressure from the middle ear space to the external environment. More recently, eustachian tube dilation has come into favor and has been shown to be quite helpful for people with severe eustachian tube dysfunction. That is where a tube is placed into the eustachian tube itself under a local anesthetic, sometimes with sedation, and expanded for a period of 2 minutes, and that can semi-permanently, as we have studies that are some years out now, open the eustachian tube. So people who are candidates for that generally are going to have that abnormal test called a tympanogram, history that is consistent with eustachian tube problems, and also a CT scan that makes sure that there are no vital structures nearby. And if there's concern about, I'm not sure this patient's a candidate, we can make a little incision in the eardrum called a myringotomy. And if that patient says, wow, that really did it for me, then they're probably going to be a candidate for the eustachian tube dilation. If they say, yeah, I didn't really get that much better with the little myringotomy, which heals over a couple of weeks, then they're probably not going to be a candidate for the eustachian tube dilation. So eustachian tube dysfunction can cause pain, but it's generally, it radiates a little bit into my neck. I can occasionally have a sharp pain, but it's not severe. It's more like a nagging discomfort. So things that aren't eustachian tube dysfunction that you should let your doctor know about would be severe ear pain, usually one side, hearing loss that is more than just a little muffled. That is not part of eustachian tube dysfunction. Vertigo, where the room is spinning around and you're having nausea and vomiting, those things are not eustachian tube dysfunction and should necessitate a call to your physician.